Hello and welcome. I'm joined today with Dr. Dunkley for another SIU Medicine Minute. How are you doing today, doctor?
I'm good, thank you.
Well, can you tell us more about the MAT program here at SIU Medicine?
Yeah, so MAT stands for Medication Assisted Treatment, and in our program, we just use Suboxone for management. We have a multidisciplinary approach, so our team is composed of doctors, nurses, social workers, and a peer counselor. In addition to your doctor's appointments, we have group counseling available and individual counseling available.
And you mentioned Suboxone. Can you tell us more about it?
Yeah, so Suboxone is an opioid, so it works in the same part of the brain as Percocet, Vicodin, and morphine, but it works a little bit differently. And so it's supposed to help with some of the withdrawal symptoms and some of the cravings, but it's not necessarily supposed to give that euphoria or that high that people talk about.
And we're talking about substances, so what are some misconceptions with substance abuse?
I think the biggest misconception about substance abuse is that it happens to a particular type of person or that someone has to have a certain characteristics in order to suffer from substance use disorder. And the reality is that's just not true. At our program, we take care of patients from all different backgrounds, ethnicities, socioeconomic status, and religion.
And how can people go about making an appointment to enter the clinic?
I think the best way to make an appointment is to call 217-545-4781. That is the direct number for the MAT clinic, and when a person calls, whether it's to get more information or to make an appointment, they will speak directly to our MAT clinic nurse. Another good thing about that process is that you don't need a doctor's referral in order to make that call.
And then do you have any final thoughts you want our audience to know about the clinic?
Yeah, I mean, I think that sometimes when people are suffering from opioid use disorder or substance use disorder, they feel very alone. They find it to be very isolating. And the reality is that help is out there, and we definitely want to help as many people as we possibly can.
That's amazing. And I'm sure you are still helping people. And is there any other things that you would say to somebody that may be suffering at home, that maybe be scared to come into the clinic and just needs that extra push?
Yeah, I think it's just, you're not alone. Like, definitely reach out, and there's nothing wrong with that. There's nothing to be ashamed about asking for help or even just finding out more information.
Well, thank you so much for talking to us today, Dr. Dunkley.
And thank you for having me.
Of course, and this has been another SIU Medicine Minute.